Okay, this video is rebutting Brooke Goldner. So this is Brooke Goldner. She's a lady doctor. She made a video criticizing me for misinformation for what I said about omega-3 suppressing the immune system. Okay. After that was when I did the question and answer on VegSource recently. And she did a pretty good job with the video. She's got sound effects and stuff. She's got a dramatic expression on her face here. So I'll show you what was talked about. Okay, first of all, a couple of quotes from some other people on, and by the way, to rebut means to push back, to speak back and answer. It has nothing to do with the butt, you know, like rams butt heads, that sort of thing, okay? So here's a couple quotes you might have heard before. Nathan Pritikin, fat is bad, after reviewing all dietary fats. Dr. McDougall, the fat you eat is the fat you wear. Fat is the biggest toxin in the Western diet. The only way to reduce atherosclerosis is to reduce all types of fat. And that's been well known, like the Blankenhorn paper. It didn't matter if it was MUFA, PUFA, omega-3, omega-6. They're all atherogenic. All fats are. In general, fats, the body wants to store them as fat. They're very easily absorbed. And, you know, a moment on your hips, forever on your lips. They go right to fat storage. As Dr. McDougall had said, you can biopsy the patient's fat, and it'll be representative of the dietary fat they eat. It doesn't get processed much. Okay, in general, the body wants to use protein to build stuff, and then the wasted nitrogen is pretty fast expelled from the body through the kidneys. You can make the amino acids into glucose if you like. All right, then the other thing is carbohydrate. The body wants to burn carbohydrate for energy. So the point is, the more fat you eat, the more likely the body is to store it as fat. Dr. McDougall, the only way, okay, we talked about that. All right, let's see here. And then McDougall and Pritikin. It is impossible to be too low fat in any naturally chosen plant-based diet. You get all the omega-3 you need from a low-fat plant-based diet. Okay, that's been looked into a long time ago. There's also the McKean and the White studies where they found that you could feed people less than 1% of dietary fat, 0.7% of fat. You need some omega-6s in there, and the people did fine. Okay, spectrum of vegan diets. The Kempner diet is a diet for the nearly dead. The Brooke Goldner diet is for the nearly dead. It's sort of like a high-fat Kempner diet. Kempner diet was especially a starch-based diet with a lot of rice, cooked rice. Whereas Brooke Goldner's diet is mostly a raw food diet. I'm going to go into more detail about her diet in just a moment, okay? She wrote a paper in Frontiers where she talked about 3 patients that had recovered from autoimmune disease, and she wrote in some detail about her dietary approach. The Esselstyn diet is also quite restrictive, and the newer addition to it was recommending greens 6 times a day that you kind of keep in your mouth and try to get the oral nitric oxide pathway going. That's especially for cardiac patients to go through all of that. The Spartan vegan diet, which is the one I recommend, is very similar to the McDougall diet, the Nelson diet, but I'm a little more restrictive. Okay, I'm 100% organic only, single ingredient only, real low fat. McDougall says his diet's about 7% of calories from dietary fat. McDougall Nelson is a little bit more lenient, and sort of for your basic, average, typical, intelligent person, they'd be pretty happy with that. The next step up in an amount of dietary fat amongst vegan diets, these are comparison vegan diets, spectrum of vegan diets, would be what I call the high-fat phony diet, which is really a moderate fat vegan diet. It's sort of the Mediterranean version of the vegan diet. This allows nuts and seeds. Nuts are very fat, like 70 to 90% of calories from fat. So just say on average about 80% of calories from fat. That's a lot of fat. Okay, soy is very fat too. They also allow caffeine and coffee and tea and flax. Some of them allow olive oil, canola oil, wine. So I think that that's quite exaggerated, and I think there is actually a movement afoot to try to replace the McDougall diet and sort of the McDougall, Kempner, Pritikin approach of a low-fat vegan diet with what I would call a moderate fat vegan diet. They're trying to pretend they're the same thing. They're not the same thing. Okay. Then there's the religious vegans. They're not too fussy, and the animal rights vegans are not fat at all. They're not fussy at all. A lot of times, high-fat phonies are animal rights vegans. Okay, and people say, "Oh, isn't animal rights nice?" Well, in my experience, animal rights a lot of times aren't that interested in human rights. So I think it's a little bit of wolf in sheep's clothing. A lot of times, animal rights are kind of phony in my experience. I was friends with a lot of farmers, and they're trying to take the land away from farmers. I'm like, you know what? We need farmers to grow food. Okay, what did I notice about Brooke Goldner? Okay, I watched some of her videos. She's actually pretty clever, pretty smart. She's a good talker, kind of funny. Like, here's a typical quote she says. The patient says, "Diabetes runs in my family. That's why I got diabetes." And the doctor says, "The reason you got diabetes is because no one runs in your family." Okay, and then I think Her best line was, she said, genetics is a menu and your lifestyle makes the order. So that was a very clever way to describe it. And she basically says, make sure you make you select with a smart choice. You carefully go over your options. So you got a certain limitation by your genetics. We can't be 7 foot tall, the center of a national basketball team. You just don't got the genetics for it. But you want to be the best version you could be of yourself. And so eating a healthy diet and exercise and getting your sleep and all those other things will contribute to you getting the best possible result that you can. Okay, so what is the Brooke Goldner diet? Well, the version I read about it, where she successfully treated 3 patients. Oh, a little bit about her background. She had a severe case of systemic lupus erythematosus, lupus, autoimmune disease, from when she's about 16 to 28 years of age. She was quite sick, and then she reversed it with a vegan diet, and now she teaches the vegan diet to help other patients. She's like a nutrition vegan diet coach. She said over the past 10 years, she's treated over 1,000 patients. She says with very good results. She hasn't put that into a paper, but she did write a paper about those 3. And she says that she is able to cure patients that the low-fat vegan diet can't cure. That's a pretty big statement there. Okay, so anyways, her phase 1 of her treatment is to try to get the patients into remission. And she gives them tons of water, like 12 to 18 cups of water per day. That's a lot of water, okay? And she doesn't say anything about filtering it. I think that would be a pretty important statement. If you don't filter water and you're giving somebody 12 to 18 cups of water, typical tap water is full of fluoride and aluminum and lots of estrogenic chemicals and other stuff. You don't even know what it is. So I was kind of surprised you didn't mention filtered. Maybe I haven't watched all of her videos. Maybe she mentions it in her other videos, but in the ones I saw, I didn't hear her mention that. And I'm like, man, filtration, that's a big deal. Okay, let's see. What else? She also says because they're drinking so much water so they don't become hyponatremic, like water intoxicated, she says they should have at least 1 teaspoon of sodium per day. Okay, then she says she likes them to have a big smoothie. I'm not a big fan of smoothies because it reduces the dietary fiber, but I realize a lot of people, there's no way you get them to eat so many greens that they couldn't make a smoothie with it. The other thing is, if you're going to make a smoothie, you got to have ear protectors. Otherwise, those things are so loud, you're going to go deaf, And so I would we got to see what % of her patients are deaf. Okay, I'm just kidding, but they really ought to have ear protectors, all right? The types of greens she recommends they put in their smoothies, things like kale and spinach and chard and cabbage and broccoli and cauliflower. She only gives them about 20 to 25% of calories from fruits like bananas, mangoes, and pineapples. That make it taste better. Okay, but she doesn't allow them any cooked food initially. So that's a very restrictive diet. So basically just a bunch of greens in a smoothie and then 10 to 20 to 25 calories from fruits like bananas, mangoes, and pineapple. Now there's also something strange about this. She's not allowing them any cooked foods. So they're getting all their calories, as far as I can see, from vegetables and then from fruits. And she's only giving them 20-25% of calories from fruits. Now I remember, I didn't look it up, but I remember hearing Dr. McDougall talk about it. He said you can't feed people more than 55% of calories from vegetables. Otherwise they get something that he called rabbit fever or something like that. I should have looked that up, but he said you can't feed somebody more than 55%. It's such a low caloric density. So the patients are probably going to lose a lot of weight, but it's hard to see where all these calories are coming from. So she's saying 75 to 80% of calories from vegetables. It's hard to get 75-80% of your calories from vegetables. There's such a low caloric density. Oh, wait, here's the other thing. Here's the other thing. Oh, wait. Here it is. Now it's clarified. Omega-3s. This is where the rest of the calories come from. She's feeding them a lot of calories. I don't have the exact amount here, but a lot of calories from flax, chia seeds, and cold-pressed flax seeds. And she even allowed them, somewhere I heard her talking about allowing them to have flaxseed oil, okay, if they don't want to eat all these chia seeds and flax seeds. Okay, so that's got a lot of omega-3s in it, especially, the flax has a lot of omega-3s, but it's also got a lot of estrogen. We'll talk about that. She supplements them with B12 and vitamin D. Okay, so that's where she's getting her calories from. Instead of carbohydrates, she's getting them from fat. Okay. Maintenance phase, she says then they can add some cooked vegan foods and more fruits. Now, omega-3s, one thing I give her credit for, she's talking about giving them omega-3s from flax and chia seeds or cold-pressed flax seeds, cold-pressed flaxseed oil. Okay, that's where it was. Where was the oil in my little summary of her work? If you give omega-3 in a flat supplement, you're more prone to lipid peroxidation. Less so when you give it in a whole food. You don't want to give in fish oil. You're worried about mercury. All fats are obesogenic. They make a person gain weight. The fatter a person is, the more likely they're to have diabetes or hypertension. So they're going to increase their risk over time, person eating a lot of fat, of gaining weight. And also, they're all atherogenic. All fats are atherogenic. And the fatter you get, the more prone you are to being diabetic or hypertension. So in a mild way, they contribute to diabetes and hypertension as well. There's papers showing that omega-3s, and now again, that's more from a supplement thing rather than specifically taking flax and chia. We don't know exactly what happens with flax and chia, but the more omega-3 a person takes in terms of supplements, they're more prone to getting prostate cancer. In the animal studies, Dr. McDougall reports on the papers of them increasing the risk of metastases in the liver. If you look at like global immunotalks, like Lydia Lynch lectured, the more fat you eat, the more it suppresses the immune system. People who take omega-3 supplements have increased risk of atrial fibrillation. Here's the Lydia Lynch Phd lady. She's got a good talk at Global Immunotalks. Flax is really fat. It's 60% of calories from fat. That's a lot. Okay? But just to give you a comparison, white rice, Kempner's diet, 1% of calories from fat. Potatoes, 1% of calories from fat. Sweet potatoes, 1% of calories from fat. Lentils, 3% of calories from fat. Okay? So 60% of calories from fat. That's really, 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 really fat. Okay, there's also cyanogenic glycosides like cyanide. Okay, I don't know about you, but I'm not interested in eating cyanide. Also, it has some similar effects to soy on premature puberty, for example. It's very estrogenic. And these estrogenic chemicals, I think these lignans in this context are sort of like insecticides. Okay, so let's take a look at some more information on these things. Here's Dr. McDougall. Oops, I'm going to get myself out of the way here. Dr. McDougall saying omega-3 supplements, they worsen type 2 diabetes. Okay, so here's one paper he talked about with regard to that. He does not recommend it. He says you get plenty of omega-3s just from eating low-fat plant foods. That was low-fat plant foods, not high-fat plant foods. Here's Dr. Esselstyn giving one of his lectures where he summarized all the data on oil. And this includes monounsaturated, polyunsaturated. All these fats increase the risk of atherosclerosis. And his diet, he had by far the best results of anybody in the world. It's like, why wouldn't we want to eat his low-fat diet? He says you'll end up with probably 10% or fewer calories from fat when you eat the Esselstyn diet. Here's just an example comparing the amounts of estrogen in these foods. So if you're recommending flax, flax is literally many, many thousands and thousands. It's literally hundreds of thousands of times more estrogenic than a lot of plant foods. Okay, it's super, super duper estrogenic. It's far, 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 like more than 3 times more estrogenic than soy. And soy is off the charts estrogenic. Just to give you perspective, okay? I wouldn't eat anything that estrogenic, all right? Anything that estrogenic, I would insist that it do a lot of other things for me. All right, so anyways, you see this lady here, it's pretty obvious why she's got high levels of estrogen, okay? She's got breasts, she's got a Virginia, okay? Why does flax and soy have such high levels of estrogen? This is a soy plant, but, I don't see any breasts, I don't see a Virginia, okay? So the point is it uses the estrogens, it appears as a pesticide, okay, to make the animal that eats it infertile, goitrogenic, to decrease their thyroid function, so maybe they won't eat that plant anymore. Some plants don't want to be eaten, So here's a little more information on flax. It's associated with early puberty onset, longer menstrual cycle. So it clearly has an endocrine, sexual, secondary sex characteristic, estrogenic features. Flax oil stimulates gynecomastia, so those man boobs are not, his big belly and his man boobs, not just a beer belly. He looks like a pregnant female with moobs, man boobs, okay? Gynecomastia, that's the medical word for man boobs, okay? From flax. I don't want that. I don't know about the rest of the guys out there. Most of the guys I know, they don't want this. All right, let's see. Flaxseed, 58% of calories from fat. We talked about that. Relatively high in protein too. Not as big of a deal, but still not something I would want. I like to keep my protein levels a little low, on the low side. Definitely below 10%. Now mine are probably in the ballpark of about 7%, 6%. Okay, flax will increase your total triglycerides in the blood. Okay, this is just showing that they find urinary thiocyanates, detoxified cyanide in the urine. I've heard some nutrition experts say, well, it's not a big deal that flaxseed eaters have detoxified cyanide in their blood. But, I worry, does it add up? Because a lot of people They're taking cyanocobalamin, it's got some cyanide in it. They're eating almonds, got some cyanide in it. And then they're eating flax. That's 3 things with cyanide. How do you know when what used to be not a little bit that your body could easily toxify versus now it's starting to do damage to your body? I don't know, but I would prefer not to eat any cyanide. Okay, here is some more information about flax, another paper about flax and the cyanide chemicals in flax, cyanogenic glycosides in flaxseed. You'll also find them in some other plants like cassava and, like we talked about, almonds. Okay. Cyanide is also a mitochondria inhibitor. I don't want to inhibit my mitochondria. They recommend no flax for pregnant women because of all these estrogenic effects. Animal studies suggest that pregnant women should limit their exposure to flax. Okay, so it's not safe for pregnant women. Why do you think it's safe for other people? Okay, flaxseed may be unsafe during pregnancy, has hormonal effects, might increase the chance of premature births. Well, that doesn't sound good. Okay, more information on flax. It's a problem with lactation. It alters the milk composition and sexual function. Okay, can affect the amount of adipose tissue, sexual function in adulthood, probably due to hyperestrogen effects. Okay, flax increases triglycerides in the blood. That's a feature of being atherogenic. Not good. The more fat you have in the blood, the less your immune system works. Immunosuppressive. Now, don't get me wrong. If I had to say, well, gee, given the options for autoimmune disease, I would first rather take the McDougall diet, okay? Because you got a good chance to cure yourself. That guy out in Florida, Stephen Esser, he said about 85% of patients will respond well to the vegan diet. But then you're going to have some that don't respond well. And I would say, well, if you don't respond well, the next thing I would try the elimination diet. And if you still don't respond well to that, then yeah, I would try the Brooke Goldner diet as a way to hopefully turn things around with the autoimmune disease. And if that still didn't work, then conventional medicine. But the immunosuppressive effect of those powerful medicines are almost like chemotherapy, you know, transplants, immune suppression. They're powerful, much more powerful drugs. Okay, and I'll give her credit, Brooke Goldner. She's talking about whole foods, okay? So I think she's a decent option if you can't cure yourself with a low-fat vegan diet or, you know, an elimination diet. You can't work out what was causing your problem. Then, yeah, sure, give her approach a try. That would be reasonable, okay? But I wouldn't jump right into it. You got a chance to cure yourself with a low-fat McDougall diet. Why jump to having to use a blender every day, the loud noise from that, driving yourself crazy with all these vegetables? That don't sound like fun to me. Grinding up vegetables all day, eating these oily seeds, estrogenic seeds. You know, I'm a macho man. I want to be macho. I don't want to be eating estrogenic fat. There's no, I don't see any glory in that. Okay, flax also can have a negative effect on the thyroid. Don't want that. Just like soy is goitrogenic. Now this is more for the supplements. They're often highly oxidized. But again, you know, give her credit. She's not talking about supplements. She's talking about whole foods, you know, the flax and the chia. Okay, here's just another paper showing what a joke omega-3 supplements are. They're not protective for the heart. They're not protective for the brain. All that stuff is totally exaggerated. There's a lot of corporate industry-funded studies that totally exaggerate the so-called benefits of omega-3s. Here's one of the studies by Brasky in particular showing they increase the risk of prostate cancer. There's other people who write about problems with omega-3s, like one of them is Brian Peskin, especially on EPA and DHA, and he claims that if you give them in high amounts, they substitute out for the omega-6 linoleic acid in your mitochondria, and then they actually damage the function of the cardiolipins. Now, that might be an exaggeration, and Brian Peskin, he's got an angle. I mean, he wants to sell the parent essential omega oils, omega-6, omega-3. So he's competing, and that's another reason why he doesn't like them. So he is biased. I'll say that is fair, but he does claim that omega-3 supplements are real bad. And again, Brooke's not recommending omega-3. She's recommending whole foods, chia seeds, and flax. Okay, here's just another showing the problems with fish. You know, besides, they increase the risk of diabetes. Okay, the more fat you eat, the more you increase your risk of diabetes. But it's certainly worse with saturated fat than omega-3s. Here's a couple papers showing increased risk of cancer. Okay, these are some of the references if anybody cares to look at them. This is the one with Brasky on prostate cancer. There were other ones on prostate cancer. Here's one on colon carcinoma metastases in rats. That's the one that McDougall always quotes. Promotion of colon cancer metastases in rats. from fish oil. Okay, and that's all I got. I hope that was of interest to you. And like I said, I would keep her option. If you can't cure yourself with a low-fat vegan, I would think her option is reasonable, but I wouldn't go to it first. So anyways, I hope that was helpful.